If you are serious about protecting your bones as you get older, you need to know this. Gentle exercise is not enough. That's not the same as saying that walking and stretching are pointless, but bones don't get stronger just because you move. They get stronger in response to loading. I'm Dr. Lynette Ewart, and I've been a doctor in the NHS for over 20 years. Alongside this, I work as a personal trainer and strength coach, and I help people learn to lift weights safely and confidently so that they know they're doing the best they can to reduce their fracture risk and the likelihood of becoming frail. In this video, I'm going to walk you through the advice that people are normally given, explain why it feels safe and sensible, but also why it is that that doesn't deliver what your bones need to stay strong as you get older. On the other side of that, I will tell you what it is you need to be doing and what that looks like in real life for you where you are at now. Often as people get older, the usual advice that they're given is take it easy, be careful, slow down. Well, there's a lack of specificity here. This is said with the idea that it might prevent sudden damage, but actually it's not really what people need to hear if they want to do the best for themselves. Let me explain why this feels reassuring to both the professional and the patient. The professional is probably thinking about fractures and about risk and about avoiding anything that could potentially go wrong, although in reality, it rarely does. On the other side of the desk, the patient's feeling vulnerable. They've maybe just been given a diagnosis and they don't know what the next steps should look like. So both parties here have got a level of anxiety, and being reassuring just makes everybody feel like they're in a comfort bubble. But that's not what people need. In both medicine and in training, if you don't define the dose, you cannot get a predictable result. Vague advice will give you vague outcomes. And that's what being careful will produce. So here's an example that gets bounced around in clinic: no heavy lifting. What does heavy lifting look like? Is it a grandchild? Is it a pet? Is it a handbag? Is it laundry? Without specifics, the patient goes away and doesn't really know what to do with that advice. The problem with that is that people then avoid structured training but are still exposed to unpredictable loads in everyday life. And in all honesty, that's where I see the most problems as a doctor. Another reason why safe advice fails your bones. Bones do not respond to comfort, they respond to challenge. Gentle exercise and activity does have its place, but it's not sending the right signal to your skeleton that it needs to adapt, a process I'll explain in a moment. But the unintended consequences of only sticking to gentle exercise is that you get people seeing avoidance as protective. What happens with greater avoidance over time is you lose more strength, you therefore lose confidence, you get greater deconditioning, and it becomes this snowball effect which does you no favours in the long run. Let's talk about what loading does do for your bones. Your bones need to be exposed to strain, and that strain needs to be relative to you, and it needs to be different from the day-to-day strain that they're encountering just through your normal routine. The strain ideally needs to be short, sharp, and have a space after it to enable recovery to happen. And this is the really important point that a lot of people don't understand. Your skeleton is not static. It is continually being remodeled, broken down, and replaced. And there are four main factors that are going to affect that process: your hormones, your nutritional status, any bouts of illness, and mechanical demand. The reason this happens is that maintaining bone is metabolically quite expensive, in much the same way that your brain creates habit loops so it doesn't have to work so hard. Your body is looking at the skeleton in the same way. And if there's no need to keep this area of bone strong, it will say, fine, let's use that energy somewhere else. Demand drops, okay, let's offset that. This is why different directions of strain really matter over time. And it's also why recovery is really important. This is how we adapt. There's a period of stress, there's a period of recovery, and following that, we adapt. So what does this loading that's going to do so much precious work for you actually look like? First of all, it needs to be planned, not rushed, and not random. It also needs to be purposeful. You need to know why you are doing this, which makes sense to align it with the movement patterns that we are using every day. It should be controlled, not rushed to get it over with. It doesn't take up a huge amount of time in your day. It can be brief. That is fine. You are not going to get more results if you spend hours and hours doing this. You'll tip over into too much stress and burnout. But it does also need to be progressive. You cannot keep the load the same and expect your body to keep adapting. Let's also talk about what it's not. And this is where you have to leave your ego at the front door. Good loading for bone health is not no pain, no gain. It's not what you see somebody else doing in the gym or in a class. It's not what you remember doing 20 years ago when your body was different, your life was different. And it's also not something that you can do easily all day and every day. There has to be a degree of challenge. Now, more often than not, people harbour two fears. One, that they will do something wrong, and two, that they are going to hurt themselves. And I completely understand this, but I can tell you from over 20 years experience as a doctor, the people I see coming in with injuries have rarely sustained that injury in the gym. It's usually moving a piece of furniture, getting the lawnmower out of the shed, getting a suitcase down out of an awkward space, unpredictable loading that the body is not trained for. And more importantly, this is what I see when people do this well. A new, renewed confidence in what their body is capable of. Building strength opens doors that you thought were perhaps closed and never going to open again. People are continuously surprised at what their bodies are capable of at any age. It is never too late to get started. People notice a difference really quickly when they start to train and challenge themselves slowly, progressively, and consistently. So if you only take one thing away from this video, let it be this. Bones don't respond to comfort, they respond to challenge. And if this has thrown up questions for you, please leave them in the comments below. And if there's any other area you want me to talk about, I'm always open to suggestions.